The question was, why does industrial animal production, why did they start using human antibiotics? Well, it's really complicated when you, not only the history, but what agency actually has jurisdiction over regulating antibiotics. So there's the Food and Drug Administration, there's the CDC, there's USDA. All of these kind of come together and in some way or another have the authority to govern the use of human antibiotics. But I think where the human antibiotics come into play is that they were just more effective. I think economically speaking, there's never been incentives for pharma companies to develop antibiotics strictly for animals. The amount of pets and species that we have as pets, our cats and dogs, are so minuscule that they can't really make money off of making an antibiotic for just a cat, although they do exist. And so I guess to answer your question, when confined animal feeding operations and the industrial animal production assembly line kind of that came out of the 40s and 50s, I think it just kind of caught on that we could keep these animals in such confined spaces. We didn't have to go in and clean their bedding or clean underneath them. We could allow them to basically live, in this really unsanitary environment, really, really packed together, or in some cases, like chickens, packed on top of each other, and just kind of feed them this antibiotic so that, at least until slaughter, they're relatively healthy enough to eat, so to speak. So I'm not exactly sure what the, actual, I don't want to say conspiracy, but what the actual turning point is. But I've seen studies that basically say that, a lot of the farm industry will say, well, it cut costs, and without using antibiotics, that's our crutch. We couldn't, the farmer would go out of business. But I've seen studies that show that there's absolutely no net economic benefit. Countries in Europe, Holland especially, is something that people are studying right now, because they cut basically all of the major human antibiotics from their industrial animal farms, and they didn't see this drastic drop in animal fatalities. They didn't see this huge increase in animal sickness. After quite a short amount of time, the farmers realized that better husbandry and a cleaner, a cleaner environment actually produces a healthier and a better product, basically. So just to kind of top off what Dr. Smeltzer was saying, I think that there's a huge, there's a huge lack of incentives for doctors to stop overprescribing, for the farming industry to stop misusing human antibiotics, and for pharma companies to continue to develop new antibiotics. There's no incentive. There's absolutely no money in it until basically it gets legislated, to kind of push my agenda, because I work on advocacy. I would say that the only real solution would be a bill passed through Congress that actually controls and incentivizes these industries to stop using human antibiotics, or use them in a more responsible way, because we need to protect the integrity of the antibiotics we have now. If we're not, if, like Dr. Smeltzer said, there's antibiotic resistance on this planet right now, and our drugs are losing their effectiveness. So.